Hi, let's start off by going through our assignment. There we go. So beginning with the vena cava, indicate the order of the structures of the cardiovascular system which blood flow through. So if we're starting with, actually let's start over here. So we're starting with vena cava. Vena cava is going to be on our right side. So we're going to be doing right atrium. It's always atrium first, A first, and then right ventricle. And then we're going to start to move away from the heart. So it's going to be our pulmonary artery. Okay. And then it makes its way back through the pulmonary vein. Oh, this is lungs. Lungs is on there. So then it makes its way back to the pulmonary vein, and then we go atrium ventricle again, but we go left atrium, left ventricle. And then our last stop is our aorta, before we go to the body, and that's it. Okay, label the left atrium, right ventricle, right atrium, left ventricle, aorta, vena cava, septum, pulmonary artery, and pulmonary vein on this diagram here. Okay, so this is our vena cava. This is our aorta. This is our right atrium. This is our right ventricle. This is our left atrium. This is our left ventricle. This here is our septum. And this is our pulmonary artery. And this is our pulmonary vein. Okay. And these are valves right here. Valve here, valve here. Yeah, that's pretty much it. Okay. Match the number that receives oxygenated blood from the lungs. So oxygenated from the lungs is when it makes its way back from the lungs is a pulmonary vein, which is going to be IV. Sends oxygenated blood to the body. So that's going to be our aorta, which is 2. Prevents backflow of blood. We're looking for a valve. It looks like 5 is pointing to a valve. Separates the left and the right halves of the heart. That's our septum, which is VI. And then collects deoxygenated blood from the body. That's the vena cava, and that's going to be I. Okay, and this one, description of vessel walls. Muscular. Veins, less muscular. Capillaries are going to be porous, thin, because they have to allow gas to exchange. Direction of vessels, blood flow in relation to the heart. So arteries are away from the heart usually, and veins are towards. And then capillaries are sort of away to towards. So they sort of bridge the gap. Blood oxygen level in the vessel, so arteries are usually high, except for the pulmonary artery when it's going to the lungs and back, and low, except for the pulmonary vein, and this is when they go from high to low. Color in the circulatory diagram, so high oxygen is usually red, blue is low oxygen, and then they go from red to blue. Blood pressure is very high in the arteries, and then veins and capillaries are lower, right? Capillaries are really thin and porous, so if you had super high pressure, you would bust those capillaries. Valves present? No. And veins? Yes. And then capillaries, you don't have valves. Pulse present. So pulse is when you have super high pressure, so you feel your pulse in your arteries, but not in your veins or your capillaries. What's the difference between the pulmonary loop? So pulmonary loop is lungs and back to heart. And systemic loop is like heart, body, heart. What does a coronary artery do? Supplies oxygen and nutrients to the heart. And lists the order that blood moves through a circulatory system, starting with aorta. Okay, so if we're starting with aorta, first thing is going to be artery after that, and then they go to the smaller arteries, which are the arterioles, and then they go capillary, and then they're in the smaller veins, which are the venules, and then veins, and then vena cava. Okay, and that's the homework. Okay, so now we're going to try some sample diploma questions. So we'll make sure you try these on your own before you watch me go through them. So the main function of the heart ventricle, right? We always go atrium, ventricle. So ventricle is going to pump blood away from the heart. Yeah, I would say so, right? This is a septum here, so that's not the answer. Direct blood towards the heart. That would be more the atrium. And receive blood from the body, that would be more atrium. I think B is definitely the best answer for this. It goes atrium, ventricle, and then to the body. Match each component of the circulatory system numbered above with the description below. Carries oxygenated blood to the heart. So oxygenated blood just went to the lungs. Sounds like a pulmonary vein. So that's going to be 4. Carries deoxygenated blood to the heart. That sounds like a vena cava. Site exchange for nutrients, that's capillaries. And has the highest blood pressure, definitely your aorta, right? That's your first artery closest to the heart. A blocked blood vessel in the diagram is A. So these things on the outside of the heart are your coronary arteries. And the function of this blood vessel is to carry oxygenated blood toward the heart, right? Arteries are usually away, but not the coronary artery. A flu vaccination is typically administered in the arm and diffuses into the capillaries. The pathway of the vaccine once it enters the capillaries. So once it's in the capillaries, it's going to go into the veins. That's the next stop. So it's going to go to the veins, then vena cava to the heart, and then it's going to go pulmonary artery and pulmonary vein. So 2143 is the correct answer for that. Okay, so you can see how you need to know all that stuff. I'm going to test you on the exact same stuff as that. So blood pressure and heart rate. So curriculum stuff, measure resting heart rate and blood pressure and determine the effects of exercise on both factors. So valves open and close to let blood flow through the heart in one direction. Okay, there's 2 types of valves. You don't need to know these names. We're just going to talk about it. So there's the AV valve. And if you look at what AV stands for, atrioventricular. So it makes sense that these are between the atrium and the ventricle. So they open when the atriums contract, and they close when the ventricles contract. And we'll see a little animated GIF of that in a sec. The other types of valves are semilunar valves, and these are between ventricles and arteries. So they open when ventricles contract and close when atrium contracts. So here's our little GIF here, right? So the atrium contracts, this is going to open up. So when these ones open up, you'll see that this is closed, open, closed, right? So atrium contract, our AV valve opens, and our ventricles close, right? Or sorry, atrium contracts, and then this AV valve opens, right? Our semilunar valve is right here. So when our ventricle contracts, it sends blood that way, And when our ventricle contracts, these ones are closed. And it's the same thing on the other side, right? Atrium open, ventricle open. Right. So it just shows these valves in here. Again, you don't need to know their names, but I just mention them just so you have some idea about the names. Okay, so as your heart beats, it makes a lubdub sound. That's the technical sound name that scientists have agreed on, and it's caused by the closing of those heart valves. So lub is louder, and that's when your ventricles contract. The dub is a softer sound. That's when your atria contract. So your ventricles are much stronger than your atrium because if you think about it, your atrium needs to send blood here, right? Your ventricles need to send blood all the way to your lungs and back, and even more, right? Atrium contract, it just needs to send it here. Ventricles contract, it needs to go all to your body and all the way back, all the way to your legs, all the way back. So these have to pump it so much further than this, so that lub, right, is louder. That's your ventricle. Dub is your atria. So these are the valves sort of flapping back and forth. They work really efficiently, not a lot of friction. They work your whole life. So when a doctor listens to someone's heart and they have a gurgle sound, that's called a heart murmur. And what a heart murmur is, it's when your heart valve doesn't close properly. So if your heart murmur is bad enough, your valves may have to be replaced. And there's a couple different types of valves that they use, or replacement valves they had. So they have, one of them is a tilted disc and one of them is a caged ball, right? So what you do is you'd place it right there on your heart, and you'd want to place it so that it's sort of in this direction, and when it's like this, blood can flow through, right? But when it's like this, there's no backflow of blood. Okay. So this question came up on the diploma, and it talked about placement of a heart valve. So if a doctor replaces your right AV valve, as shown in the picture, which placement of the replacement valve is correct, 1 or 2? Right? So you have to think of what's going to happen with that ball, right? So if we place it like this, this atrium is going to contract, and it's going to push that ball forward, and it's going to close it, and you're not going to get any blood flow through your heart. So this would not be good. But this position, right? This atrium contracts, it's going to push blood, it's going to push that ball forward, and then when your ventricle contract, it's going to push the ball back, it's going to allow blood to flow, so it's going to work out. So this is how you would want to place it. Factors affecting heart rate: exercise, right? Drugs, alcohol, stress, medications. All these things can affect your heart rate. So the normal adult has a resting heart rate between 60 and 100 with an average of 72. And this is a number that the diploma uses and you have to memorize. So 72 beats per minute is what we're going to use. So that's just the average. A well-trained athlete can be around 40 beats per minute. So this is just your resting heart rate. So your heart rate's going to increase when you exercise. And once your body reaches about 85% of its maximum heart rate, you produce lactic acid, and that increases pain. And that's so that you don't push your body too hard, push your heart too hard, that you have, that something bad happens to you, right? So your maximum heart rate would be 200, 220 minus your age. So right around 200 for you guys. And lots of people think they want their heart pumping like crazy to exercise. That's the only way to exercise, and that's not actually true. It depends on your health goal. So if you want to just maintain your fitness level, you only want your heart rate around 100 beats per minute because you're just trying to maintain that fitness level. If you're trying to burn fat, you want to be 60 to 70%, so 120 to 140 would be the optimal heart rate. And if you want to do cardio, you want to be around 140 and 160. So some people push it too hard. Some people might be trying to burn fat, but they push it too hard and they just end up increasing their cardio and do a worse job of increasing their fat. So yeah, that's depends on what you're working out for. It depends on what you want your heart rate to be. So blood pressure has two measurements. So when your ventricles are contracted, it's called systole. And when your ventricles are relaxed, it's called diastole. And your blood pressure is given as two numbers, systole over diastole. So normal blood pressure, you need to know this, is 120 over 80. So this is a bigger number, this is a smaller number, right? And it makes sense. I said that those ventricles are stronger. So when your ventricles contract, you get this bigger one, and when your ventricles are relaxed, you get this smaller one. So in terms of which number is more important, this diastole is more important because this is the pressure on your blood vessels, on your arteries all the time, right? This is a minimum possible pressure. If this is high, it means you always have high blood pressure, right? This number is only when your ventricles are contracted. So this number is still important, but not as important because if this is high, it's not all of the time. So diastole is more important. It determines the pressure on the arteries when ventricles are relaxed. And the way that you measure your blood pressure is with a sphygmomanometer. Sphygmomanometer. Usually we call it a blood pressure cuff because who wants to say that word all the time? So you need to know how your blood pressure is taken. So nurses would do this or a machine would do this. So normally blood flow through your artery. So what you do is you need to put a cuff around it. And the first thing that cuff is going to do is the pressure in the cuff is going to be above 120. So it squeezes it super hard. And what happens is blood flow across this artery is stopped. So it gets no reading. What a nurse will do is she'll listen. She'll put a little stethoscope right here and she'll listen. And she doesn't hear lub or she doesn't hear dub because you sort of pinched off that artery. And then this cuff will start to slowly decrease. Slowly start to decrease. And remember that we have 120 over 80. So when it goes below 120, you should be able to hear the lub. You should be able to hear that first sort of higher pressure one. Right? And then you decrease it below 80, and then you should be able to hear the dub, right? So what a nurse would do is she would listen, she would find out, okay, lower, where do I first hear that lub? Okay, 120, lower, where do I hear that dub? Okay, that's gonna be the 80. Or a machine will do that as well. So 120 over 80 is optimal, so this is the optimal range. If you have over this, it's called hypertension. So high blood pressure is called hypertension. There's lots of factors that affect blood pressure, right? So again, your diet, stress, exercise, medications, drugs and alcohol. Those can all affect your blood pressure. And the one I don't have here, genetics. Genetics affects your blood pressure almost more than any of these. And sometimes you have high blood pressure and it's not your fault. You eat healthy, you don't do drugs, you exercise, you're not on a medication, but your genetics is a big factor in it. You might have narrow blood vessels. Okay, so dangers of high blood pressure. So hypertension is having long-term elevated blood pressure. It can be caused by genetics, excess body weight, smoking, diet in high salts and fats. There's typically no symptoms, so that's why whenever you go to the doctor, they usually check your blood pressure because high blood pressure is a serious thing, but you can't tell if someone has high blood pressure just by looking at them. So an aneurysm is a bulging balloon-like area of the blood vessel. It usually develops in a weakened spot in your blood vessels. So if you have high blood pressure, it increases your chance of having an aneurysm. They usually happen in your aorta, or they can happen in your brain. So if they happen in your brain, that's really dangerous. It can cause blurred visions, headaches, seizures, and you don't want to have that happen in your brain. So blood pressure is highest in arteries and lowers as you move away from the heart. So why does it have to be highest there? Well, it has to make it to your toes and back, right? You need high blood pressure to be able to make it to your toes and back. What do veins have to protect against low blood pressure? They have valves. So blood travels slowest through the capillaries, but it's not the lowest pressure, it's just the slowest, right? It allows for all the nutrients to be picked up. So it's like medium blood pressure, slowest, and you think, well, capillaries are really tiny, right? So if you take this hose, this is kind of like an artery, and then you pinch it, and that's making it smaller, kind of like a capillary. You think you'd have this like super high pressure, super high speed or anything like that, but it's not actually like that. Because we have so many holes, it's more like this. If we have so many capillaries, right, it sort of spreads it out, and it doesn't actually increase the pressure. It helps slow it down and helps for oxygen exchange and nutrient exchange. Okay, so that's all. If you have any questions, let me know.